This morning, some victims' families from the Sandy Hook school shooting plan to announce they are suing the manufacturer of the gunman's assault rifle. The man who killed 20 children and 6 adults 2 years ago suffered from severe mental illness. In the past 2 years, 10 states actually decreased funding for mental health treatment.
Former Congressman Patrick Kennedy is here. While in Congress, he wrote the mental health parity law that urges treatment for mental illness be the same as physical illness. He is now the co-founder of One Mind, an advocacy group. Last night on 60 Minutes, Scott Pelley interviewed a woman named Ashley who suffers from bipolar disorder and her mother. She fought their insurance company to pay for treatment after Ashley attempted suicide.
In 2012, Ashley was in the hospital for the 4th time that year. They thought they had taken away everything that could hurt her, but she smashed her cell phone and cut her wrists with the glass.
What did that tell you in terms of the treatment that she needed?
It told me that she needed long-term treatment to survive.
Maria says that Anthem recommended treatment at Timberline Knolls, a residential facility. A doctor said Ashley needed 90 days, but after sending her to Illinois from California, Anthem denied payment after 6 days, saying that Ashley could be safely treated with outpatient services.
Did the people at Timberline Knolls believe that?
No,
she was well now?
No, they absolutely didn't believe it. They gave us the option of paying $22,000 to complete the 30 days. And there wasn't a chance that we could do that.
Now, look at how Ashley's care was denied. This log shows Dr. Tim Jack, a psychiatrist working on behalf of Anthem, called Ashley's doctor 3 times in 32 minutes. One call was disconnected. He left 2 messages. Dr. Jack waited 22 minutes for a call back and then denied coverage. From the first call to denial, 54 minutes speaking to no one.
Patrick Kennedy, welcome.
Thank you, Charlie.
What's your reaction to Scott's piece?
Well, it's all too familiar tragedy that mental health is not treated like the rest of physical health. The notion that there was 95% to 100% denial rate for mental illness, whereas you would never expect that for cancer, diabetes, or cardiovascular disease. When I wrote the mental health parity law, the objective was to simply treat brain illnesses like the rest of physical health. It's not complicated, but what is complicated is getting to the details of how medical utilization review, medical necessity determinations are made. I invite the insurance companies to really come forward now that this new law is in place and outline how they will make these medical utilization review decisions. Because what's most frustrating is the lack of transparency in how they make these decisions. As you saw in your report, this doctor never saw Ashley and was making a decision really on the fly, and of course was reimbursed basically to deny. So we need to clear this up. And there's still going to be medical management, but what we want to do is make sure there's no more adverse decisions against the mentally ill as there would be against cancer. That is the operative point.
You say, Congressman, that we have to see mental illness in a new way, that you have to see these people not as morally flawed. So what do you think it will take that people do not see them as morally flawed? If it didn't happen in Newtown, which is one of the most graphic cases, what do we need to do? What will it take?
Well, we need more brain research, but we also need to apply what we already know. Most people don't think you can treat mental illness, and that's part of the stigma. We have new tools today to treat these illnesses, unlike ever before. We need to put those into practice. And I think people's attitudes will shift once they know that their loved one actually can be successfully treated.
Let me read what Anthem Insurance, because they sent 60 Minutes a statement, which reads in part, throughout the care of these individuals, our behavioral health professionals explored and provided the patients and families numerous care options that went beyond their covered benefits. So what steps do you think patients, families can take to get the right kind of care? How do you manage these insurance companies?
Well, right now in the Second Circuit Court here in New York City, United Health is now being sued for a similar set of circumstances. This is applied to many insurance companies across the field. What we need from the administration, the Department of Labor regulates these through ERISA plans. They need to set forth some very strong compliance measures to get disclosure. Disclosure is what's going to allow us to determine whether they're making these decisions overtly against the mentally ill, where they wouldn't do so if it were against cancer, cardiovascular disease, or diabetes.
Well, Congressman Patrick Kennedy, so good to see you, and thanks for
Nora.
your continued work on
I
this.
appreciate that.
It means a lot
Thanks,
to families
Tara.
who struggle
Thanks,
with this.
Gail.
Thank you for coming.
Thank you.